And also next technique is next management, fracture management is with the traction. So this is going to be in case of any like a if the condition is not treated with the POP applications or surgical procedures, sometimes it suits for the old age people. So and also in different type of the fractures are going to be depends upon the how to do the different type of the tractions. So this traction is application of the pulling force of the body. So it may be either direct pull or indirect pull. So how to give the, that means if the fracture fragments are there here, if it is the rear is displaced, so if we give the tractions, it's going to come to the neutral position, it's going to come to the alignment. So we are going to reduce with the traction. So traction is less common in the orthopedic wards nowadays, although it has its a place. But nowadays, many people are not doing the distractions, but there are still some advantages are there with the distractions. So these uses of distraction are so to restore the bone or limb length if it is has reduced by the fracture or disease. So we are going to reduce the length of the limb length or reduce the fracture or disease. So in these conditions, we are going to use the traction. And as to maintain the correct limb length. So in case of the shortening because of the fracture or like a displacement, or maybe is abnormal position of the limbs, so may chance to get the short limb length. So if you give the traction, we bring them into the normal position. And also overcome the muscle spasm, which may be cause the limb shortening after the fracture. So because of the muscle spasm or because of the muscle overactivity also, so it pull the bone fragments in the other directions. So because of these things, may chance to get the limbs, may chance to get the shortness. So if we give the traction, so we can bring into the normal positions, maintain the alignment. So these are going to be the types of the structures are going to be, one is the skin tractions. So this skin traction is going to be force is applied over the large area. This spreads the load and also some comfortable and also efficient. So if you see the skin tractions, so we have to apply the crib bandage. So along with the lower limbs and also at the edge, we have to give the weight. So because of this weight, this weight is going to pull the long axis is going to give the traction and also to prevent the friction at the bone fragments. So where they get the fracture, and in this case of the intracapsular fractures are going to give most commonly in the old age people is going to give in the case of the tractions. The force is applied is transmitted from the skin to the bone via superficial fascia, deep fascia, and also intramuscular septa. So it is going to be the traction is going to get from the skin and also bone via the fascia. So these are the main mechanism of the skin tractions. So for better efficacy, the traction force is applied only to the limbs distal to the fractures. So always we have to give the traction distal to the limb. So it is going to give the best results while giving the tractions. So when is indicated the tractions? So temporary management of neck of the femur of the fracture. So it's a extra intracapsular fracture of the neck of the femur. And also in case of if the patient is having like a high diabetes and also the blood sugar levels and blood pressure levels are high. So it's not like a indicator for the surgery. In those conditions, skin traction is the only one option to prevent the complications. Femoral shaft fracture in the children's, undisplaced fracture acetabular, and also after reduction of the dislocation of the hip. So after dislocation of the hip, so I have to maintain the traction force to maintain the joint in the normal positions. To correct the and also the minor fixed flexion deformities of the hip and knees. So if any minor deformities, so we are going to do with the skin traction. Next one is the skeletal tractions. So these skeletal tractions are going to be is in case of any injury or especially is the any lacerated wounds conditions. And also is going to be, this should be in case of the patient having a skin traction is contraindicated. So in case of skin traction is contraindicated, in those conditions are going to give the skeletal tractions. And the patient with the lacerated wounds, the patient with the external fixators in situ, and also when the weight is required for the traction is more than 6.5 kilo in the obese patient. Because of if you give the skin traction won't maintain the more than 6 kilos. So because of it is going to superficial traction, it can maintain the like only less than like a 4 kilo or 3 kilo can maintain with skin tractions. If it required more than 5 to 6 kilos, so in the obese patients, so we are going to do the skeletal tractions. And also the skeletal traction is a means pull exerted directly on the skeletal system by attaching the wires, pins together, and also tongs into the thoracic bone. So you are going to apply all the slings and pins are going to arrange. So he's going to get the skeletal traction. So in this one, if you want to give for example, knee traction, So also hip traction here going to stabilize with the knee and hip with the slings, and also we are going to apply the pins at the knee joints. So how to give the traction is in the long axis directions. So this is traction is going to be applied continuously for the extended period. So here we have after the application of the pins inside the joints is going to give the continuous tractions. So because of the continuous tractions, so we are going to give the we are going to give the best results to prevent the complications. So that is about the skin traction and skeletal tractions. So also the one of the major part in the treatment and the fractures. So that's all about the treatment fractures, the management of the fractures, the immobilization with the POP application, and also open reduction internal fixation and and also external fixators. Conservative management with the POP and also surgical procedures and also skin tractions. So these are the different type of the treatment management for the fractures. So in the next class, we are going to discuss about what are the fracture complications we are going to discuss. Hope you understand clearly. If you have any doubts, please you can ask me through the message so I can clarify your doubts. That's all about today's topic. Thank you very much. See you in the next class.